Hey everybody, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation. And if you cannot guess who I'm going to be talking to right now with this hat on, it is the ultimate human with the ultimate AI in healthcare, the CEO and founder of Olive, Sean Lane, also the CEO of Circulo, Medicaid plan that's built on top of his system. So Sean, thanks for the hat, man.
You're very welcome. It looks awesome. I love it. I love that you're wearing it this time.
Yeah, you think I can rock it better than you?
Yes.
We're going to have to do a who wore it better on Twitter. You're going to have to vote people.
Totally. Yeah, no, it looks awesome.
I definitely don't think I can pull it off the same way, but thank you for the hat. You guys have a huge presence here. The Olive buses driven in.
Yep.
Yeah, and tell us what you're doing, because you guys have had two big announcements at this show. One of them is this new thing that you're launching called the Library, and I'm not entirely, I understand what this is, so can you explain it to me? Let's start there.
Yeah, no, I'd love to. So the library is a marketplace, and it's where we can have partners come in to our customer base. So we have a huge customer base now, over 1,000 hospitals, most of the major health systems in our country. We're now unlocking a huge payer network as well of customers. So the library is a way for us to bring the best technology in healthcare to our customers. Okay. And the neat thing about Olive is we have access to lots of data, to the EMRs, to different workflows, and we're able to take that data and connect it into our partners so that our customers get the benefit of their great technology. And then the library name is inspired by, effectively when the printing press was created, it's when knowledge was able to be distributed. Yeah. And we feel like it's a way for us to distribute all the wisdom of healthcare in one spot.
Ooh, good branding coming out of Olive, big surprise. Okay, so I want to ask this though about this. So what kind of technology are you talking about? Can you give me some examples? So are you talking about like digital health point solutions? Or are you talking about different types of analytics things that your clients can bring into the fray to like make more sense of their data? Like tell me exactly what that means.
It really is open to any technology that can help automate healthcare, right? Okay. So if you think about, in healthcare, there's so many manual processes. There's so many processes where humans are intervening when they shouldn't be, when there could be technology that does it. So any type of application or software or even service that helps automate healthcare should be on the library. Okay. And so an example would be a voice assistant for the call center, right? So be able to bring that in. It could be something that helps understand the treatments for back pain. It really is everything from clinical to operational, administrative, and nothing is really off the table. It could be something for the food and beverage operation in the health system. As long as it automates and creates a lot of efficiency, then we want it in our library.
Oh, that's really cool. That's awesome that it's so wide-reaching as well. I really like that. Yeah. All right, I want to ask about one of my favorite parts of the automation game that you guys are playing here in terms of claims payment. And so I want to hear about Olive Assures. So you guys launched this, and this was like such big news to me. I'm like such a geek when it comes to payment model stuff. And this is awesome because it really changes the amount of time that a health system has to wait to get their claims paid. So, you guys are instant paying stuff, right?
That's right. And not only does it change the amount of time it takes to get paid, it takes all of that work out of the process. Yeah. So today, the cost of collection is huge. You may get paid $1, but it really feels like 70 cents because you're spending 30 cents to collect it. With Olive Assures, we are paying instantly and eliminating the cost of collection. So as soon as you submit a claim, Olive pays you. So we have machine learning models that predict exactly how much you're going to get paid from both the payer and the patient. We then pay that amount, and then we collect from the payer and the patient. Okay. And we're using machine learning algorithms across millions and millions of claims to be able to do that. And we are now a full-service clearinghouse. So we submit the claim, we receive the remission back, the remit back, but all of that is happening, days later after we've already paid the claim.
Oh my God. How come nobody's ever done that before?
I think it's a good question, and it's not about having the resources that were capital. It's about being able to predict the payment. So with machine learning and with our massive amount of connectivity into claims, we can predict very accurately what the payment's going to be. So for us, it mitigates the risk. And I think that machine learning capability is what has mitigated a lot of the risk.
Is there anything else you're doing with that information? Like in the sense of like, okay, you're obviously learning a lot about the way that claims get paid, what gets denied, what gets approved, like certain combinations of codes that have to be there, right? So you're learning all of this stuff, which lets your brain make a decision, right, about whether to pay right away or not. Right. So it's like, this to me seems unprecedented in our industry. Has anybody ever looked at claims data like that?
So I think that there has been the opportunity to look at claims data, but we need to do so much more with the data that we have to unlock the intelligence and the wisdom. Go back to that library concept. We don't just need the wisdom to sit in the individual brains of humans. We need that wisdom to be accessible to everyone in healthcare, to create true intellectual and intelligence equity, like information equity, so that people know exactly how to get a claim paid or exactly how to treat, a right knee replacement. And we are doing all those things imaginable with that data. And we're constantly looking at the insights and intelligence that data provides. And we've only scratched the surface, but we're going to be doing a lot more of that, especially here in the near future. We're going to unlock a lot of that wisdom and make it available.
Ooh, can't wait for that. You're gonna have to come back and talk to me about that. All right, I want to ask you how health systems are doing. How are the hospitals? Because you and I spoke, and I would refer everyone to a previous interview with Sean, where we walked through Olive's business model in like painstaking detail. Like this is like a 30-minute chat about everything Olive does. So please go check that out. But I mean, one of the things that's always like really impressed me about your model is the fact that you guys are trying to help hospitals, who I think a lot of times are overlooked in terms of the digital transformation of healthcare. It's like you and your EMR can just stay there, but you guys are automating all of the back office administrative tasks. How are things going with hospitals? They got hit hard during COVID. So I mean, like, give us a sense of what's going on, and also the fact that you share knowledge that you learn from one of your clients with all of the others in like obviously a de-identified macro level way. The Olive gets smarter as it learns in each of its different systems, but talk a little bit about that.
So we have a concept: when one olive learns, all olives learn.
Yeah, that's the line.
And the idea is that when we learn how to do something better or apply data in the right way or change a process, and it's kind of like genetic algorithms, right? So like when a mutation in a process survives longer than the other process, that new process now reproduces more processes. So in that way, we are looking at the processes that generate the best result, and we continue to learn and get better and better and better. And these health systems get to work collectively to do that. So that's when Olive learns, all olives learn. During the pandemic, what we realized was Olive was an essential employee, an essential worker. During the time when people were leaving the office and having to stay at home and on lockdown orders, Olive was there every single day. Olive never missed a day of work during the entire pandemic. We went from producing about 30,000 FTE of human power to 75,000 FTE of human power in less than 12 months. We grew our company from 200 people to 1,200 people just over the course of the pandemic, and that includes over 600 software engineers building all this technology. So the health systems, were under incredible duress during this time, and we were just proud that we had the opportunity to be there to help them keep the lights on and keep the processes flowing, keep the money coming in, to ensure that claims are getting paid, to ensure that things were continuing to operate during the pandemic.
All right, cool. I like hearing that. I'm glad that you're there to support them. I want to hear a little bit more about Olive Ventures. So you guys launched your venture fund now, and so you're investing in stuff. And I have to say, like between this concept of the library, if I'm understanding it correctly, I mean, great opportunity for some of these health tech startups or digital health startups to put their wares out and make it available to a hospital, whatever it is, right? Mm-hmm. But also now, I mean, you're funding stuff through your own venture fund. Tell me a little bit about why did you decide to do that?
I think platforms are going to have the most massive impact in the healthcare industry than anything else that we've done. And what I mean by that is empowering companies to be successful, empowering people in their dorm room, in their basement, in their garage to build applications that truly change the industry. It is incredible, and you have to behave like a platform to do that. That means you have to allow 30 competitors to be on your platform, succeeding, helping them succeed, helping them distribute to all your customers.
That's so un-healthcare.
But that's so far we've not had a true platform.
Right.
But you have to behave like a platform to be one. So that means bringing them all in, giving them distribution and access to all your customers, giving them developer tools and resources, which we're doing, and also investing in new companies to be built on the platform. We want to build billion-dollar companies on top of Olive. And I believe that within 2 years, we'll have at least $2 billion companies on our platform built from scratch, which is, I think, going to be super exciting. But in more than that, we want to enable hundreds of thousands of developers to build applications for healthcare using the library and our developer tools.
I think that's really exciting. And I think I'm curious to hear your take on this. So it's like, we hear about like the one platform that is kind of in existence. You can't really call it a platform, but EMRs. Give me a sense from where you sit. And as you guys are working, to automate a lot of this back office stuff, you're taking on claims, you know what I mean? You're doing that. It's like, what happens to the EMR? I feel like I keep hearing shadows of this in places where it's like, it's not necessarily got the lock that it once had. It really is just turning into a patient record, and that's about all. Like, what are your thoughts on that?
So platforms, true platforms, democratize the technology in a way that give the consumer a ton of choice. Yeah. And when there's choice, that I think it'll change the game for EMRs. Look, I think that the EMR companies that exist have done an incredible job of creating technology for healthcare. I mean, it's saved countless lives. I mean, it's incredible. It's been incredible. The challenge is none of them are really platforms. They don't behave like platforms. Like, could you build an EMR on an EMR? Like, would they allow that? No. If they don't allow that, you're not a platform. You have to allow that. That's how platforms behave. So therefore, they're not actual platforms. They're fortresses with, a drawbridge that comes down occasionally for partners, but they're not a platform. So think about let me think of something like accounting. Like if you used Quicken back in the day, you know what I'm talking about? I don't know if that's still a thing, but now that is now competing with probably 1,000 to 2,000 applications on the App Store. Right. So is it going to be one of those 2,000 apps that does effectively the same exact thing, pieces of it at the atomic level, or all of it at even a way better level, or Quicken? And I think the answer is obviously, one of the 2,000 apps that are available. That's what platforms do. And I think we need to do that with every piece of the healthcare stack, including the EMR.
How far away are we from something like that? I mean, obviously you guys are you've got guys who put a lot of money, you guys have a lot of money backing you into making that happen. Do you think like we're 5 years out from that, less, more?
I think we're there. We're just at the very early days of it. Okay. This journey is going to take decades. Look at the App Store, for example. The Apple App Store was 2007. Right, it's now 2000. It's now 2021, and we're still seeing it blossom. Right, it's still growing. Yeah. We're still learning from it. The Android store came after that. The Google Play Store, and it basically duplicated. There's now apps in two places in most cases. But what that did is it created distribution in the pockets of billions of people for app developers to now get their wares into the hands of the entire planet. And I think we have a long way to go to get there, but it's starting now. I've noticed that there are a lot of platforms. Yes. Now, it depends what people mean by platform. Some people mean big software. Some mean truly we allow everybody to come and build on us, including competitors. That's a real platform. So what I would say is, with the right resources, the right investments, which are available right now, we can distribute a brand new company into hopefully 1,000 hospitals in a month.
I'm excited for this. Seriously, it's so inspiring. It's like, I think typically in healthcare, it's like if you're on the innovation side, you want to do the move fast and break things, but this is like a be patient and avoid risk kind of business. So it's exciting to hear that you guys are working on this and that it's rolling out faster than,
It's more of a move fast and fix things.
There you go. Yeah. I like that better.
Yeah.
All right. Talk to me about Circulo. So this is the Medicaid plan that you are building on top of your Olive system. And the goal when I talked to you about this at the launch was one member, $1 of revenue, and one provider.
One member, $1 revenue, one provider. So
by the end of the year.
We decided to go down this platform route at Olive. And to do that, I didn't want to just build the space shuttle. I wanted to be the first astronaut, right?
I love it.
So I wanted to go and start the first big company on the platform. And that is Circulo. So it's the Medicaid plan of the future. We're truly rethinking the entire way Medicaid is done. So we are like, for example, we have a bold claims program, 0 prior authorization, 0 denials, payment immediately, all using Olive's great capabilities and tools, including in Circulo's automation on top of that. So we can do extraordinary things on top of this platform, and we're trying to prove that. So Medicaid is an important part of our society. Absolutely. And we have to create an incredible product. In my view, Medicaid should be the best insurance on the planet, and we're trying to do that. We're trying to provide that level of care. So it's going great. We're growing fast. We have about 90 people now. We've raised $50 million. We are growing very quickly. We're going to start opening practices. So we're actually going to have Medicaid clinics. We call them primary health sites. So that's one thing that's relatively new. We are also working with the intellectually and developmentally disabled to provide better care to them, to that population. We're also, we have a thing called the Circulator, which is
Circulator.
a sprinter van out providing telemedicine-based care in the communities. So we have definitely we will hit all of our goals this year, and I think it's going to grow extraordinarily fast.
I feel like
Maybe even
everybody
faster than Olive did in the early days.
Wow, that's a bold statement. I mean, but I think people are really looking for, what does Medicaid look like in the future? I think everybody really recognizes how not up to snuff that experience is for patients, and I applaud you for taking a stab at that, because that's a hard thing to innovate in.
I agree, but it's totally worth it.
Yeah,
I think our society will be judged on how well we treat the population of the most need.
All right, last thing for you. I want to hear about Olive. Everybody talks about the valuation. Everybody talks about all the money you've raised. In fact, you and I have talked about all the money you've raised. So how are things going? I mean, I know you guys have hired. You've been on like a hiring spree. I mean, you dropped the number of employees you grew up to. But are you feeling any pressure to scale up with all of that financial backing?
I think our goal is to grow extremely quickly, because the challenges that we have are insurmountable. I think, we have nothing but incredible growth in our future. We grow by one medium-sized company a month, by close to 150 people every single month. Thanks a lot. It's good to meet you in person.
Yeah, it's good to meet you too in person. Like, seriously, and thanks for the hat. For anybody who missed out on health, did you drive that bus that you have on the exhibit hall floor over here, or did that just come?
I didn't drive it here, but I'm driving it back now. I'm not driving it, but I'm not. I don't think I'm qualified to drive that bus. Even though I used to drive things bigger in the military, but.
We'll have to get in. That's another interview. That involves some drinks. Yeah. It is seriously so nice to meet you in person. Thank you so much for stopping by and giving us an update on all things Olive and all things Circulo and everything else that you've got going on. Big stuff. Really exciting to watch.
Thank you, and likewise.
All right, thank you. All right, for more interviews with the who's who of health tech, please check out my YouTube channel over there at youtube.com/WTF Health. I'm Jessica DeMassa with Sean Lane, the CEO and founder of Olive and also Circulo. We'll talk to you guys soon. Thanks.